Hey, Nurse Key here, and I was replying to this question. Okay, so you asked, why do we give or why don't we treat fluid overload in cardiac patients with albumin versus the most likely treatment that we give is diuretics? So, first we have to get down to basics, right? So, when we have fluid in the body, there's only about three places that it can go. We want it in the blood vessels. It can go under the skin when we have fluid overload, right? It goes under the skin, which we call edema. It starts at the ankles and it works its way up the body. And then it can start to actually leak in places we never really would consider or it shouldn't be, the belly, the lungs, or just random places. Inside the blood vessels is normal. This is like our blood. We have fluid. We know like plasma. This is actually what is expected and wanted. When we get to edema, which is actually what we see in the early symptoms of cardiac or CHF, congestive heart failure, is edema. And so we'll treat it with diuretics. So in CHF, the problem is not necessarily the fluid, that is a symptom. The problem is that the heart is not pumping effectively, right? We monitor the EF or the ejection fraction, which tells us how adequately the heart is actually contracting. We know that generally in CHF, it gets progressively low, and so the problem is the heart pump. So now that we know that the heart is the problem and it's not pumping or contracting adequately, and now our patient is fluid overloaded, we treat with diuretics. So diuretics basically tells the body, hey, we have a lot of fluid, we need to pee it out because obviously the body is not able to circulate it and get it out by itself. So we're going to help the patient along. So why don't we give albumin? Albumin is generally given to liver dysfunction, which we see with the abdominal swelling. We see, and that's with third spacing. So third space is the random fluid buildup in random pockets, stomach, lungs. Albumin is generally for, it's not to say that that person is technically fluid overloaded, but it's just in the wrong spaces. So what albumin does is sucks the fluid back into the proper spaces, which would be the blood vessels. That is our end goal. So it would help with circulation. So I hope that answers your question. Hopefully I didn't make it too complicated.